I'm going to bring up a problem with your department, very same problem I'm recently having with the environmental EPA. So it isn't just your department that this might be a problem. But last month, I wrote oversight letters to 15 HHS contractors and grantees. Those 15 organizations received some of the largest contract awards for the care and placement of unaccompanied children. My oversight work is based on new information that shows many children may have been placed in a very dangerous situation. I want to know what these contractors are doing to ensure children's safety. In response to my 15 letters, your department sent an email to contractors and grantees on February 28th that I want to quote. Kindly direct Senator Grassley's office to HHS's Office of Assistant Secretary for Legislation for this request, end of quote. My staff have been told by contractors that they're ready to respond to me, but HHS instruction has so far caused them not to. Do you accept the premise that recipients of congressionally appropriated taxpayers' money must respond directly to congressional oversight requests? And I hope you can answer that positively, that they should. If not, when will, if you would agree with me, when would you direct your staff to clarify to recipients on my letter that they must respond to Congress? Now, we had EPA saying these letters I sent to other groups spending taxpayers' money, that they could respond directly to me. So can you say that for your department?
And Senator, as a former member, I too wanted to be able to conduct oversight when I was in the House of Representatives. And so absolutely, these contractors, the various entities, Americans have every opportunity and right to respond directly to you. We offer to provide them with some guidance if they wish to have it. They were under no obligation to get it, but you are absolutely within your rights, and they are as well, to be in communication.
Okay. So as a follow-up, just let me be very clear. These folks that I wrote to have received together billions of dollars of taxpayers' money. When I and my colleagues send them requests for information, they have an obligation to respond, and this administration's interference, which evidently we're not going to have anymore, at least for a while, has been obstructive. Then another question, if HHS receives a law enforcement request for information relevant to a child's trafficking investigation, does the HHS provide that information to law enforcement without requiring a subpoena?
Mr. Chairman, we work on an ongoing basis with law enforcement throughout the country because, again, we have custody, temporary custody for minors. And so we continue to work with law enforcement throughout the country. Yeah. We follow the rules. In some cases, we're dealing with very private, sensitive, confidential information. And so we make sure we follow the rules so we don't violate any individual's privacy at the same time that we're fulfilling our obligations to respond to law enforcement.
Are you saying in some cases you can direct directly to law enforcement without a subpoena? And then are you saying in other cases you might need a subpoena?
We try to make sure that we're complying with the law when it comes to providing information. Some information is more confidential than other pieces of information, so we make sure that we're not violating any privacy rights, any protections in providing information, whether it's to law enforcement or any other entity.
This will have to be my last question, and then I'll submit for writing answers. At last year's budget hearing, you and I discussed supporting rural health care, including the need for CMS to fully utilize the Rural Community Hospital Demonstration Program. Right now, CMS is only using 25 of its statutory 30 hospital spots for this program. You told me last year that HHS would, quote unquote, do more to support rural hospitals in need. Following our discussion, I wrote CMS administrator. Then at my request, the CMMI director met with 2 rural hospitals interested in joining the program. but that's where the progress stalled. CMS explained that in order to fill the open spot, it would require 12 months of work and too many hospitals would be interested. If CMS has the tools to help one rural hospital and isn't, you should be doing something about it. I realize you might not know about every program at HHS, but why doesn't your department want to help 5 rural hospitals through this program? It's budget neutral, and Congress has reauthorized it 3 times since 2003.
I know time has expired, Senator, Mr. Chairman, may I respond?
Just briefly.
Briefly, Senator, let's follow up on this, but what I will tell you is if you take a look at the president's budget, and we can get back to you with a number of the projects that we've undertaken in rural America, we are doing a great deal, especially with many facilities that are on the verge of closing, and that would be even worse for many parts of rural America. But let me follow through with you on your particular concerns, because we have quite a bit to talk about when it comes to our work in healthcare for rural America. And this budget, as you will see, makes major investments in rural America.
We're going to